right, let's jump into a deep dive today into the world of Taiwanese healthcare. I think a lot of our listeners probably already know that Taiwan kind of blends traditional Chinese medicine with Western medicine. But what's super interesting is that it doesn't just stop there. They've added this whole other layer of alternative therapies,
Yeah.
creating what they call an equalization model.
And that's really a key distinction. Instead of just creating a hierarchy with Western medicine sitting at the top, Taiwan offers this real buffet of choices. You need pain relief. Okay, you could opt for pharmaceuticals. You could try acupuncture, cupping, gua sha, you name it. It's really all about finding what works best for each individual.
I like that. It's a refreshing change from the
Yeah.
one-size-fits-all approach we often see.
Right.
Okay, so let's unpack this a little bit. We got some fascinating sources here today about acupuncture being used for everything, from pain to stroke risk reduction even, and the rise of cupping and gua sha, maybe you've even tried those, and also how Taiwan makes sure that there's quality control, even for these ancient remedies.
Yeah, and what's fascinating to me is just how deeply TCM is woven into Taiwanese society. It's not something they just pulled out of a history book. It's a living, breathing part of their healthcare system.
Wow.
Their modern resurgence really took off after Japanese rule ended back in 1945.
Yeah, and it wasn't just a small group of people either. Between 1996 and 2001, over 62% of the Taiwanese population used TCM. It's mind-blowing how normalized it is,
Yeah.
especially considering it's integrated into their national health insurance.
Exactly. Imagine just being able to visit an acupuncturist and having it covered by insurance. It really speaks volumes about how Taiwan views TCM not as this alternative, but as a legitimate part of healthcare.
That raises a question for me, though. Wouldn't covering TCM through insurance be incredibly expensive? How does Taiwan even manage that financially?
Yeah, it's definitely a complex issue, but I think part of the answer lies in their approach to healthcare as a whole. By really embracing preventative and holistic care, they're able to address health concerns early on, and that can potentially reduce the need for more costly interventions down the line.
So it's not just about covering the costs of individual treatments. It's more about creating a system that just promotes overall well-being and prevents bigger problems from popping up.
Precisely. And one of the key examples of this integrated approach is the Division of Integrated Chinese and Western Medicine at China Medical University Hospital. Here, you see Western doctors and TCM practitioners collaborating, truly working together to find the best solutions for patients.
But it's not just TCM, is it? Our sources mentioned a whole range of alternative therapies that are gaining traction.
Yeah.
It seems like reflexology is huge over there.
Absolutely. In fact, you'll even find foot massage paths with pebbles built right into their parks. It's this incredible blend of ancient wisdom and modern accessibility.
Oh, wow. That's amazing. I can picture people of all ages and backgrounds taking advantage of that, not just those who can afford expensive spa treatments.
Exactly. And what's even more interesting is that they're not just preserving their own traditions. Taiwan is also very open to imported therapies like aromatherapy and macrobiotic diets. It's a true melting pot of wellness options.
So it's not about being exclusive or dogmatic. It's about finding what works and offering people those choices. It sounds like they're really embracing this idea of healthcare harmony.
Yeah, and a big part of that harmony is the focus on acupuncture, which seems to be a cornerstone of their TCM practice. Our sources indicate that its use in Taiwan rose significantly between 2002 and 2011, from about 8% to almost 11%.
But is that just because it's culturally ingrained or whatever?
No.
Or is
Right.
there any real evidence to support its effectiveness?
Well, there's actually a growing body of research, both in Taiwan and internationally, that suggests acupuncture can be highly effective for various conditions. They're using it for everything from musculoskeletal disorders to injuries, nervous system diseases, endocrine and metabolic issues, pain management, stroke rehabilitation, and even easing cancer-related symptoms.
Okay, so that's a pretty broad range.
Yeah.
What are some of the specific conditions that are at the top of the list for acupuncture treatment in Taiwan?
Well, musculoskeletal pain and injuries are definitely major reasons people seek acupuncture. Think back pain, neck pain, those kinds of everyday aches and strains. They're actually the most common conditions treated with acupuncture in Taiwan.
So in Taiwan, if you pull a muscle,
Yeah.
are you more likely to go see an acupuncturist than reach for a bottle of ibuprofen?
It's certainly a possibility, yeah. It's a reflection of how ingrained these practices are in their healthcare culture. And the interesting thing is, there's real science backing up acupuncture's effectiveness for pain, especially when it comes to chronic pain.
Really? What kind of scientific evidence are we talking about?
Well, Taiwanese studies have shown that acupuncture can significantly reduce chronic pain in conditions like back pain, neck pain, osteoarthritis, and even those nagging chronic headaches.
So it's not just anecdotal evidence. There are actual studies showing that it works.
Exactly. And there was this one particularly fascinating study that linked acupuncture to a reduced risk of stroke in patients with fibromyalgia.
Wait, hold on. Reducing stroke risk with needles. That's pretty incredible. Is that a widely accepted finding?
While the study itself focused specifically on stroke risk in fibromyalgia patients, it does suggest that acupuncture might have broader positive effects. On managing the condition, which often involves chronic pain as a major symptom, more research is definitely needed. But it's a really intriguing area of study.
It sounds like Taiwan is really at the forefront of exploring these connections between acupuncture and various health conditions.
Yeah.
But how do they even ensure that someone, like wielding needles or prescribing herbs, actually knows what they're doing? It can't just be a free-for-all, right?
Well, that's where the Ministry of Health and Welfare comes in. They play a huge role in regulating TCM in Taiwan, and they take quality control very seriously.
So it's not like you can just hang up a shingle and declare yourself a TCM master.
Not at all. First off, TCM practitioners need licenses to practice, which means meeting specific education and training requirements. And it doesn't stop there. The ministry also keeps a close eye on the quality of TCM materials, especially herbs.
Makes sense. You don't want people brewing up mystery potions with unknown ingredients.
Right. And to address that, they created the Taiwan Herbal Pharmacopoeia, which sets standards for herbal medicines. It ensures that the herbs used in TCM practices are safe and effective.
So they've got licensed practitioners
Mm-hmm.
and quality control on the materials. What else does the ministry do to promote and support TCM?
That they actually support clinical research to develop new TCM-based drugs. They're not just preserving ancient practices. They're looking for ways to innovate and potentially bring TCM into the modern pharmaceutical world. They even integrate TCM into their national health insurance system.
Wow. So in Taiwan, you could literally have your acupuncture treatment or herbal remedy covered by insurance, just like a visit to a Western doctor.
That's right. It's a testament to how much they value TCM as a legitimate part of their healthcare system. But even with all this integration, there are still some who see TCM as being marginalized. And that's a challenge they're working to address.
Why is that? They have licensed practitioners, quality control, even insurance coverage. What's the missing piece?
It comes down to the regulatory frameworks. You have separate scopes of practice and licensing requirements for TCM and Western medicine, which can create a sense of division rather than true integration. And that's what we'll explore further in the next part of our deep dive.
It sounds like there's still work to be done to achieve true harmony between these different systems. Stay tuned, folks, because in part 2, we'll delve deeper into those challenges and explore whether Taiwan's model could hold valuable lessons for a more holistic approach to health globally. Welcome back to our deep dive into Taiwan's healthcare system. In the last part, we talked about how they've successfully woven traditional Chinese medicine into their healthcare system, and even cover it with national health insurance. But we also left off on a bit of a cliffhanger. This idea that despite all that progress, TCM might still be viewed as somewhat marginalized.
And that's a really important point to consider. You know, it's not just about offering TCM alongside Western medicine. It's about creating a system where both are truly valued and, integrated.
So what are some of the, practical challenges in achieving that true integration?
Well, one issue is that having separate regulatory frameworks for TCM and Western medicine can unintentionally create a sense of us versus them.
Yeah, even if it's not intentional, it sounds like that could make it harder for patients to navigate the system and for practitioners from different disciplines to collaborate effectively.
Exactly. It's like having two parallel roads that rarely intersect.
And that disconnect could potentially impact patient care. Right. Imagine someone with a complex condition that might benefit from both Western medical interventions and TCM approaches.
That's a great point. If those two worlds aren't communicating effectively, patients might end up missing out on potential benefits. There's also the risk of treatments clashing if practitioners aren't aware of what their counterparts are doing.
So instead of getting the best of both worlds,
Mm-hmm.
you could end up with treatments that are working against each other.
Exactly.
It seems like true integration requires more than just, coexistence. It needs that active communication and collaboration.
Absolutely. And that's where this push for modernization of TCM comes in. Taiwan is actively working on incorporating more scientific paradigms into TCM research, education, and practice.
But wouldn't that risk, stripping away the essence of TCM? which is based on a very different philosophical framework than Western medicine.
It's a valid concern. There's definitely a risk of oversimplifying or misinterpreting TCM principles if we try to force them into a Western scientific mold.
So how do you modernize these ancient practices without losing their core values?
Well, it requires a delicate balancing act. It's about finding ways to validate the effectiveness of TCM treatments using rigorous scientific methods, like conducting clinical trials and stuff, while also respecting the holistic nature of the practice.
So instead of trying to fit a square peg in a round hole, they're finding ways to bridge the gap between these two systems.
Precisely. They're even exploring how TCM principles can be applied to modern drug development, potentially leading to new and innovative treatments.
Oh, wow, that's exciting. It sounds like they're really pushing the boundaries of what's possible in integrative medicine.
They are, but while those efforts to bridge the gap between TCM and Western medicine are underway, let's not forget about that fascinating array of alternative therapies that Taiwan has embraced. We touched on reflexology earlier, with those pebble foot massage paths in parks, but there's so much more to explore.
Right. It's not just about high-tech hospitals and cutting-edge research. It's about incorporating wellness into everyday life.
Exactly. And remember, the popularity of these alternative therapies isn't limited to any particular age group or income bracket. You'll find people from all walks of life embracing cupping, gua sha, aromatherapy, macrobiotic diets, you name it.
That's really interesting. In some Western countries, alternative therapies are often seen as a luxury for the wealthy. But in Taiwan, they seem to be much more integrated into the fabric of society.
It's a reflection of their holistic approach to health and well-being. They see these therapies not as something extra or indulgent, but as a vital part of maintaining balance and preventing illness.
Okay, let's dive into some of these specific therapies. We talked about cupping earlier. Those suction cups are hard to miss, especially with athletes. But beyond muscle soreness, what else are they using cupping for?
Well, in TCM, cupping is believed to improve circulation and energy flow throughout the body. They use it for respiratory issues, circulation problems, pain management, even for relaxation and stress relief.
So it's kind of a multi-purpose tool in their healing toolkit.
Exactly. It's fascinating how they've adapted this ancient practice to address such a wide range of modern-day ailments.
And what about gua sha? I'll admit, the idea of scraping your skin with a tool sounds a bit intense.
It might sound daunting, but it's actually a very gentle technique. They use a smooth-edged tool, often made of jade or stone, to gently scrape the skin, promoting blood flow and releasing tension.
So it's not about causing pain, it's about stimulating healing.
Exactly. They believe that this scraping action can help break up stagnation and promote the flow of qi, or vital energy, throughout the body.
It seems like a lot of these TCM practices are based on this concept of energy flow and balance.
That's a key principle in TCM. They believe that illness arises from blockages or imbalances in the body's energy system, and treatments like acupuncture, cupping, and gua sha are designed to restore that balance.
It's a very different way of thinking about health than the Western medical model, which tends to focus more on treating symptoms.
Absolutely. But what's fascinating is that while those approaches might seem very different on the surface, they're not necessarily mutually exclusive. In fact, there's a growing body of research exploring how these ancient practices can complement modern medicine.
We talked about how Taiwan is integrating TCM into their healthcare system. But what about these other alternative therapies? Are they viewed with the same level of acceptance?
Well, while they might not have the same level of formal integration as TCM, there's definitely a high level of acceptance and openness towards these practices in Taiwanese society.
It sounds like they've created a healthcare ecosystem where people have the freedom to explore different healing modalities and find what works best for them.
And that in itself is a remarkable achievement. It's about empowering patients to take control of their health and make informed choices.
It's a very different approach than what we often see in Western healthcare systems, where patients are often expected to just follow doctors' orders without question.
Right. In Taiwan, they're encouraging a more collaborative approach, where patients and practitioners work together to find solutions that align with individual needs and preferences.
It's like they're saying, here are all the tools, let's figure out together what works best for you.
And that's a powerful message. It shifts the focus from simply treating disease to promoting overall well-being.
It sounds like a healthcare utopia.
Yeah.
But are there any potential downsides to this anything-goes approach? How do they ensure that people aren't falling prey to quackery or potentially harmful treatments?
That's a crucial question. While Taiwan encourages exploration and choice, they also recognize the importance of safeguarding patient safety. That's where the Ministry of Health and Welfare plays a key role.
So they're not just throwing open the doors and saying anything goes. There's still a level of oversight and regulation to protect the public.
Absolutely. And they're constantly working to improve those regulations as new therapies emerge and gain popularity.
But even with regulations in place, there's always the risk that people might be drawn to unproven treatments, especially if they're desperate for a cure.
You're right. It's a delicate balance between encouraging innovation and protecting patients from harm. And it's a conversation that's happening not just in Taiwan, but globally, as more and more people seek out alternative approaches to health.
It seems like there's a real hunger for these non-conventional approaches, and healthcare systems around the world are grappling with how to respond.
Exactly. And Taiwan's experience offers some valuable insights into what's possible when you embrace a more open and integrative approach.
But it's not a perfect system, right? There are still challenges and potential drawbacks to consider. We'll delve into those in the next part of our deep dive, so stay tuned. Welcome back to the final part of our deep dive into Taiwan's approach to healthcare. It's been a fascinating journey exploring how they've blended traditional Chinese medicine with Western practices and even embraced this whole array of alternative therapies. But as with any system, there are always challenges and potential drawbacks to consider.
That's right. You know, it's important to remember that Taiwan's healthcare system, like any other, is a work in progress. They've made incredible strides in creating a more holistic and inclusive model. But there are definitely still hurdles they face in ensuring true harmony between all these different approaches to healing.
Yeah, we've talked about how having separate regulatory frameworks for TCM and Western medicine can unintentionally create a sense of division, even when the goal is integration.
So what are some of the potential downsides of having these parallel systems, even if they've intended to complement each other? Well, one concern is that it could lead to this fragmentation of care. If a patient is seeking treatment for a complex condition, that requires both Western and TCM approaches, navigating two separate systems with different practitioners, regulations, and potentially even insurance coverage. Could be incredibly confusing and time-consuming for patients. It could even delay or complicate their treatment.
Yeah, it sounds like a logistical nightmare, especially for someone already dealing with a health crisis. Instead of seamless integration, you just end up with a system where patients have to become experts in navigating the complexities of two very different worlds.
Exactly. And that fragmentation could also hinder collaboration and knowledge sharing between TCM and Western medical practitioners. If they're operating in silos, they might miss out on valuable insights and treatment options that could really benefit their patients.
So instead of leveraging the strengths of both systems, you end up with a situation where they're almost competing with each other. That doesn't seem very conducive to creating a truly holistic and patient-centered healthcare system.
You're absolutely right. And that's why there's this growing movement in Taiwan and globally to bridge that gap and create a more unified approach to healthcare. This involves incorporating more scientific paradigms into TCM research and practice, while also respecting its holistic philosophy.
But isn't there a risk that trying to scientize TCM could strip away its essence? After all, it's based on a very different understanding of the body and how it works compared to Western medicine.
That's a valid concern. It's crucial to approach this integration with sensitivity and respect for the unique traditions and principles of TCM. It's not about trying to force it into a Western scientific box, but rather to find ways to validate its effectiveness using rigorous research methods while still preserving its core values.
So it's about finding common ground and building bridges, rather than trying to erase the differences between these two systems.
Precisely. And that requires open-mindedness and a willingness to learn from each other. Western medical practitioners can benefit from the holistic perspective and personalized approach of TCM, while TCM practitioners can gain valuable insights from the scientific rigor and technological advancements of Western medicine.
Yeah, it sounds like a true partnership, where both sides have something valuable to contribute.
Exactly. And when you have that kind of mutual respect and collaboration, you create an environment where innovation can flourish and patients can truly benefit from the best of both worlds.
It's an inspiring vision for the future of healthcare. But as we wrap up this deep dive into Taiwan's unique approach, I'm curious to hear your thoughts on whether their model could serve as a blueprint for other countries, or if it's too culturally specific to be replicated elsewhere.
It's a complex question, and there's no easy answer. Taiwan's success in integrating TCM is deeply rooted in their cultural history and values, but I do believe there are valuable lessons to be learned from their experience, regardless of cultural context.
What are some of those key takeaways that other countries could apply to their own healthcare systems?
I think the most important lesson is that patient choice and empowerment are essential. Taiwan's system recognizes that there's no one-size-fits-all approach to health, and that individuals should have the freedom to choose the treatments that align with their beliefs and preferences.
That's a powerful shift from the more paternalistic model we often see in Western medicine, where patients are just expected to follow doctors' orders without question.
Right. It's about moving away from that hierarchy and creating a more collaborative partnership between patients and practitioners.
So patient autonomy is a key takeaway. What else can we learn from Taiwan's approach?
Another important lesson is the value of integrating traditional healing practices into mainstream healthcare. For centuries, cultures around the world have developed their own systems of medicine based on their unique understanding of the body and the natural world. These systems often offer valuable insights and treatments that can complement modern medicine.
So instead of dismissing these traditional practices as outdated or unscientific, we should be exploring how to integrate them in a way that's safe and effective.
Exactly. It's about recognizing that there's wisdom to be found in these ancient traditions, and that by blending them with modern knowledge and technology, we can create a more holistic and effective healthcare system.
It's about expanding our definition of what constitutes healthcare and recognizing that there are multiple pathways to well-being.
And that's a powerful message. It's about moving beyond the limitations of a purely biomedical model and embracing a more holistic vision of health that encompasses the physical, emotional, and spiritual dimensions of well-being.
It's been a fascinating and thought-provoking exploration of Taiwan's approach to healthcare. Thank you so much for sharing your insights and expertise.
It's been my pleasure. I hope this deep dive has sparked some curiosity and inspired you to explore the possibilities of integrative medicine.
And for our listeners, we encourage you to continue this conversation. What aspects of Taiwan's model resonated with you? What challenges and opportunities do you see in applying these principles to your own community or healthcare system? Share your thoughts, and let's keep this dialogue going.
Until next time, stay curious and be well.